Hey guys, I'm Fiona and I'm here with Mia, the hygienist, and we're talking about how to care for your All-on-4 teeth. How do I clean my All-on-4 teeth?
Implants are a bit trickier than teeth, but we have to treat them like they're teeth. So a lot of the times people think, oh, they're fake teeth, I don't need to clean them, that's grand. But the truth is they can get problems as well. So we need to keep them super clean, keep the bacteria away. So there's loads of different aids like implant floss, which you can basically poke through at the top where your prosthesis meets the gum, kind of. You poke it through, pull it in and kind of do this motion to get rid of the plaque, and then you just pull it out. Or you can use little TP brushes. A water flosser is actually quite good for implants, all that kind of stuff, just to flush out around the implants, because they're like a root of a tooth basically. They still can get bacteria, they can still get gum disease around them.
How's the implant floss different from regular floss?
When you floss a tooth, you wrap it around and you pull it up, but these are all connected like a prosthetic. So you can't floss like normal floss. So this floss has like a pointy bit of kind of fabric that it's almost like you're putting in threading a needle. Yeah, you get it in at the space and then you pull it through, and there's a lovely soft part that is really absorbent. And when you floss it back and forth in that motion, it cleans out under the prosthesis. So it's completely different. You should do it daily at least.
How often do I need to visit my dentist after getting All-on-4 teeth?
How often, they tell you? Usually for like cleanings and stuff, 3 to 4 monthly, because they do need to be maintained and everything.
What do I do if I have an issue with my All-on-4 teeth?
Straight away, contact your dentist. Whoever was the person who did your implants will help you out. They'll just have a look, make sure everything's okay. Sometimes it might just be an adjustment, tiny things. You might feel a little bit of tenderness, especially when you first get your implants, because it's the whole healing process and everything. But when in doubt, just contact straight away, just to be safe. They'll just have a look, take care of you anyway.
And so what kind of things are normal that you could expect that a person who got the implants might find strange or sore, but it's like standard?
Just like tenderness around where the implants were placed, especially in the first kind of few weeks after. It's just like anything, you get a cut, it's going to be a bit tender. But after the healing, it shouldn't be sore once they've healed. If they're sore, contact your dentist.
What do I need to know before getting All-on-4 teeth?
It's important to be aware that it's not just like get them done and that's it. You do have to take care of them, keep them clean, and they can get gum disease and that can lead to problems down the line. The same as teeth, but they're actually harder to clean than teeth, and that's just a fact. Sometimes people think, oh, it's grand, I'll just get implants, but it is something that you have to think about and keep clean. People sometimes just disappear, we never see them again, and that's not the way it's supposed to be. It's supposed to be taken care of. It's like servicing your car. You don't just buy your car and keep it for 20 years and not get it serviced, because by the time you go to get it serviced, there's going to be a lot of problems. Whereas if you come regularly, everything gets checked, you're not going to have any issues.
And what are the kind of issues that you could face if you don't come in regularly?
Basically what happens is bacteria builds up around the implants like it would a tooth, and that causes the gums to be like, what the hell? The bone then is like, I don't want to be here. It starts to migrate away from the implant, same as a tooth, migrates away from the root of the tooth, and you can get gum disease around the implants or implant failure.
Okay, so the gum feels that like unnatural feeling of like infection and starts to recess or reject
anything in your body. If it's your eye, your gum, your whatever, if there's bacteria there, they react with inflammation. It's like response to a stimulus basically.
Yeah.
So if it sees bacteria, it's like, I need to protect myself, and it actually kind of resorbs the bone away from the bacteria. It's running away.
Yeah.
But then obviously we need our bone to keep the implants in, to keep our teeth in. So, but if you're getting cleanings regularly and you're getting them checked and you're cleaning them at home every single day, then you won't have those problems down the line.
What can I expect after getting All-on-4 teeth?
I find with the patients that I've seen post-op and stuff, the first kind of few months, they're just like, it doesn't feel 100% normal, but they're like, it's fine, but I'm just aware of them. And then after a few months, they come in and they're like, they don't even feel like they have anything different. So it's just kind of an adaptation. So you kind of have to bear with it. It's like getting a filling. Sometimes you kind of feel, it feels a bit weird, but it's comfortable. So, and then after a month, you're like, oh, it's actually fine. The initial sort of getting used to it is like something you can expect. And then with regards to the hygiene difference, it's pretty much the same in the sense you need to clean them twice a day, morning and night. They still get the same bacteria, but you're going to be using the kind of different tools. And the best thing is to get advice from your hygienist or your dentist to show you in person how to clean them.
How do I look after my All-on-4 teeth?
Treat them as if they are your teeth. You just want to keep them super clean and you want to keep them being looked after. So first thing is always have a regime with seeing your dentist. So at least once a year to see the dentist, and then getting your cleanings for 3, 4 or 6 monthly, but it depends on the person. So you will be advised to see 3 monthly, 4 monthly or 6 monthly based on your case. You can't just say one size fits all because different people have different gum types and all this complicated stuff. So we will tell you how often you should be coming in. But with home care, just keeping it as clean as possible. So you have 4 implants and then you have your prosthetic on top, and you need to keep the prosthesis clean. That can get plaque. It's same as like a denture. Like when you take out a denture, that has plaque all over it if you don't keep it clean. So you need to keep that clean itself and the actual implants clean by using the floss as well. But a lot of people like the water flosser with the implants.
Yeah, I suppose you don't have to do that looping it in.
Yeah, like you can flush like underneath.
And how long should you spend overall brushing, flossing, like start to finish?
Really depends on the person,
Yeah.
And their dexterity and different things like that. So I don't really care how long it takes once you do each tooth for 5 seconds here, 5 seconds there. It ends up being longer than 2 minutes, let's be real.
And brushing is as normal. It's flossing that's slightly different than if it was your regular teeth.
Yeah, there's this other little brush that I really like. It's called a single tufted brush and it's really good. It's just like one tuft and you can just kind of get it at the implant and just do little circular motions and keep it clean around where the gum meets the teeth.
Thanks so much for watching, guys. If you'd like more videos like this, feel free to subscribe and we'll see you next time.